Okay, so our presentation will be on St. John's Wort by Ryan Baumgartner and Michael Rolls. So essentially, what is it? It's also known as Hypericum perforatum. It's a flowering shrub native to Europe, and it contains active ingredients such as hyperforin, has all the pharmaceutical effects. Essentially, you can get it from teas, tablets, and liquids. And I guess a fun fact is called St. John's wort is because often this flower bloomed during his feast day. And so, who would use it? There's been evidence on good effects for people with depression or menopausal symptoms, and it has some preliminary studies on anti-inflammatory and wound healing effects. But I think mainly there's a lot more so during not on humans, but there's some promising evidence there, but they're kind of hard to come by. So the general effects are that the active ingredient hyperferrin is known as a major antidepressant. It's shown to inhibit the neuronal uptake of serotonin, norepinephrine, and dopamine. It also can block uptake of GABA neurotransmitters, and which can lead to an anxiety, which is a pretty common symptom. In general, St. John's wort is known to change a person's mood, kind of like a mood booster, like a general antidepressant is what it pretty much acts like. So some side effects, there's a laundry list, so I just kind of pulled out some of the big ones. Anxiety, dry mouth, dizziness, insomnia, irritability, photosensitivity. Big thing is that you do not want to take it while pregnant or breastfeeding, and you need to make sure you consult your doctor before taking it due to some pretty bad drug interactions that could occur. And then, so these are a list of some of the drugs. You can see some antidepressants, Xanax, digoxin. There's all kinds of stuff. So, and a lot of these drugs are pretty common in people, so that's why you need to consult your doctor before taking.
The effects similar to other drugs. St. John's wort is found to have similar effects to the SSRIs, which makes sense because it treats depression. And then it also treats hot flashes associated with menopause, which is similar to drugs such as venlafaxine and gabapentin. So for our studies, the first study here is going to be a meta-analysis on the efficacy of St. John's wort in treating depression, and it found that St. John's wort extract was comparable to the SSRIs in efficacy, including clinical response, remission, and mean reduction in HAMD score, which is just an objective measure of depression symptoms. The study demonstrated significantly lower rates of adverse events of depression in patients who used the St. John's wort compared to the SSRIs. The next study that we found is also for treating major depression. The patients were randomly assigned to receive the St. John's wort, a placebo, and then sertraline for 8 weeks. On the two primary outcome measures, the two drugs were not significantly different from the placebo, and it found that St. John's wort was not effective in the treatment of major depression. Our third study here is also on major depression. This study found that it was significant in decreasing the total score of that HAM-D scale with patients who take that St. John's wort. St. John's wort may reduce the frequency and severity of hot flashes in menopause, and many women reported reduction in the total severity during the trials. Recommendation: consult your doctor before taking St. John's wort for the treatment of depression and menopausal symptoms due to the lack of regulations in the United States. St. John's wort is proven to be effective in the treatment of depression and menopause, but interacts with many drugs. And if taking any medications, avoid taking St. John's wort unless approved by your doctor. And these are our references.
Thank you.